Okay, this is a Miss Bowers. Miss Bowers presented to us. She was actually referred to us by a friend of hers who also had severe low back pain. She was a former patient of ours. That patient was actually having very similar symptoms to Miss Bowers. They knew each other through a friend of a friend. Long story short, she came in for a free consultation and basically presented with this MRI for me. There's multiple things that are going on with Miss Bowers' back. We can see as you go through, we've got a little bulge here, we've got a little bulge here, and we've also got some slippage here. This is called spondylolisthesis. This is a grade 1, very, very common finding, and I don't know if you'll be able to see this, but you can see the bone has slipped forward just ever so slightly. Whenever you have that, that creates an instability. And whenever you have instability, that obviously is going to cause more forces onto the discs. And the discs don't like that. They're not really designed for shearing motions. Miss Bowers she had a flexion extension study done in the past, and it was actually done by a chiropractor previous to us, and he wanted to see if the joint was stable. The joint was stable, however, she was still not able to get any long-term relief from him, particularly with her left leg pain. And if we look over here, we're looking at the spine sideways, just like this. This is called a sagittal view of the spine. And what we're looking here, you can see a pretty good view of that disc. But if you go right up in here, this is actually supposed to be nice and clear and white. It's supposed to be full of water with like a little black spot in the middle with our nerve root coming out here. But if you can see, there's her L5-S1. That's the disc actually impeding or creating spinal stenosis in there. So she's got a bulging disc that's actually causing spinal stenosis. Miss Bowers has been in pain for about 3-4 years. She is on visit number 9 on spinal decompression right now. She presented with a VAS, which was her pain level, of a 7-8 when she started with us. She's at visit number 9. She's at about a 1 or a 2 right now. She was actually considering surgery for this. With the spondylolisthesis, it would require bolts and screws and pins. After thinking about that, she then came in and did a consultation with us. And with my experience in doing this procedure for about 6 years now, she'll be perfectly fine. I don't foresee her needing any follow-up. She might have a hitch every now and again in her life, but we could probably tune that up in 1 or 2 visits. But right now, at this point, a positive prognosis is expected. She's now capable of doing all of her physical therapy at full strength with no sharp or shooting pains. And she is very, very extremely compliant with her homework. And she's been walking tremendously for us now, up to a mile or 2 at a time a day. And we suspect that that will continue to increase. Again, L5-S1, highest success rate in our office, the very bottom disc. Fortunately, that's also the most common in the low back to have problems. Thank you. This is just another example of non-surgical spinal decompression.